This video is talking about the hair genome test. And so what the hair genome test is a very precise way of measuring your sensitivity and resistance to medical therapy for hair loss. The traditional way of doing medical therapy is just to dose you at a standard dose. And these preset formulations are helpful. For the vast majority of people, it does work. However, in my opinion, I like what I call the lowest effective dose. Basically the dose your body needs, and sometimes that lowest effective dose is way above what the standard dose is, and sometimes it's under it. And I've always been surprised when I get the data back from this genome test exactly what dose would be helpful for you. So for example, finasteride is usually dosed at 1 milligram orally, and 5 milligrams for a male for oral minoxidil, or 2.5 milligrams for women, for example. Or the topical dose for finasteride is 0.25% usually, and it's usually 5% for minoxidil, for example, although there's different formulations and different variations out there. Whenever I get the test back results back from this test about 4 weeks later, I find really interesting data. For example, I recently had a woman at 61 years old that it came back she needed 0.3 milligrams of dutasteride and 3.75 milligrams minoxidil. So it was amazing that how precise this was. And then I find on the topical doses, I get 9% minoxidil and a very low percent of finasteride, or whatever it may be, or they need a dutasteride dose. And that is what's always shocking to me, is how accurate this test is. And I've seen patients with much better clinical outcomes with this test because they get a very, very customized, tailored option and solution to their problem. So that's either topical or oral, and the data comes back for both. So the way that this test works is it looks at your genetic receptors and finds out what you're sensitive to. So let's break down an example. So for example, with minoxidil is a therapy that is traditionally at 5%, but a lot of patients don't have what's called sulfotransferase, which is an enzyme that helps activate and make minoxidil work in your scalp. That has to exist in your scalp. The oral method will bypass it. So if you're going topical, 30 to 50% of people don't have much sulfotransferase. They need a higher dose of minoxidil. So it depends on your level of genetic sensitivity. With the oral dose, you also may need a slightly different regimen based on your sensitivity. So even though your sulfotransferase enzyme is not as critical because there's not a need for it because it's not in your scalp, you still could have a different level of genetic sensitivity and resistance. Initially, when I did the genome test, I only did it for patients that really wanted the topical because I knew that the topical route was much more sensitive to dose alterations. But for patients that really wanted to do the test for the oral, I found that I was actually quite inaccurate, that the oral dosing is very sensitive and it gives me a lot of information. The reason a lot of these patients initially, when I counsel them not to do it for the oral, but they still did it, is because I wanted them to get some information on supplements, because this exam will actually give me very detailed information about supplements. So instead of doing Nutrafol, Viviscal, and having a standard dose, this will tell you that you are sensitive to three different drugs, and these are the ones you need in terms of it's a particular type of supplement, natural supplement. So it gives you even information about that. If you don't live in Dallas, by the way, I can ship the test to you and have the data back to me, and I can actually do a very precise biochemical formulation and have that prescription given to you. The problem nowadays are people just getting sort of generic standard doses and formulations that are not really fine-tuned to their anatomy. The other thing with this is that it gives me a lot more genetic details as well. So as I mentioned earlier, with a topical formulation, there are other genetic parameters that are very interesting. Great example is a lot of formulations, like I've used 82F in the past, I still use it now, which is a standard formulation for the scalp. It uses glucocorticoids as well as tretinoin. But this test will actually look at, do you actually need a glucocorticoid? Do you need a tretinoin? Is it actually adding sensitivity to your formulation, or is it not? So this test gives me a multi-page readout of exactly what you're sensitive to. The one thing I'll ask you is to give us the ability to adjust the dose from what you have. For example, it may say for a younger gentleman that you're relatively resistant to minoxidil and not to take it. Well, if you're a young gentleman and I'm very worried about progression of hair loss, I'm still going to dose you at a higher minoxidil dose, even though you're relatively resistant to it, because I want the best shot at minimizing progression. So there's so much more information about the genomic test that I can tell you about, but I think these are the general ideas that most people ask me about. And if I didn't mention this already, it's not a blood draw, it's a buccal swab. I swab your mouth, I get the diagnosis back in about 4 to 5 weeks, and then I'm able to titrate the dosing that's needed. I use a really, really good pharmacy that works on the highest grade formulations out there, because a lot of the stuff out there on the generic level just doesn't have the purity and the efficacy out there. So hopefully this short video on how I use the hair genome test, when I use it, is helpful. And this is good for, I hate if I didn't clarify this, both genders, male, female, young or old. It is my standard of care right now in terms of figuring out the best dosing regimen and resistance and sensitivity to you as an individual.